Again, let me introduce myself again because we've gotten cut off. So I'm Dr. Yogita Tailor. I'm a physiatrist in Atlanta treating chronic pelvic pain. And again, pelvic pain can be so multifaceted and so complex, and nutrition can play a huge role. And so I'm so thrilled that you, Monique, have joined our team and you're able to kind of help guide our patients in the nutrition aspect, and excited to chat with you today.
Thank you. Yes, I'm excited to be here. It's such a great team. Everyone's so amazing and so passionate about our cause. Yes, it's a big deal, and a lot of people silently suffer with all of the pelvic symptoms. So I'm Monique Bogni. I'm the Director of Integrative Nutrition and Health Coaching at Pelvic Rehabilitation Medicine, and I help people individually and through my group programs understand what to eat to help to heal their body and reduce symptoms or even eliminate them. And even through my own process of understanding what my body needs, what's healthy for me, I've eliminated symptoms just with diet and lifestyle changes. I mean, it's really powerful what we put into our bodies, and I feel like everybody knows that, but there's just so much confusing information out there. So it's really understanding that no one diet works for all, right? It's like why some people are like, Whole30 is amazing, and someone else was like, that didn't work for me, because we all have to tweak our diet or what we eat individually. So
Absolutely.
that's what I help people with.
That is awesome. Yeah, I completely agree with that. And again, I talk about nutrition a fair good amount with most of my patients that walk through the door. And some of the initial conversation is, what triggers your pain? And sometimes patients have certain foods, whether it's in general like spicy food or caffeine, but sometimes it's something more specific, like if I eat processed sugar, it's going to trigger my pain, and I know it. And sometimes we also talk about things that can help calm things down, or even like hydration. Hydration is a huge part of nutrition that sometimes, again, is understood, but sometimes not necessarily thought about as much. And again, in our day-to-day, we forget about hydration too.
True. Yeah, it's easy to forget about. We get busy, right? We're just doing things, and at the end of the day, it's like, I'm so hungry, but maybe I'm thirsty.
Absolutely. And sometimes dehydration can be a little tricky too, because I often see patients who have urinary symptoms where they feel like they have to go all the time, or they have that urgency where they gotta go, or they're like, every 30 minutes or so, they're like, I am in the bathroom. And it's kind of like, okay, they feel like maybe I should avoid drinking water or drinking whatever. But in actuality, we got to hydrate. We got to kind of, train our bladder to be holding that urine, and we got to get those nutrients inside our body. So hydrating is super important, even when we're dealing with urinary symptoms.
Yes. Well, and on that note, the liquids help flush out the toxins and the bacteria that are causing that, right? So it's like, when I know that when we're in it, when we're healing, we can, it can just feel so painful and overwhelming. It's just, but if we accept the process, right? When we have a urinary tract infection, there's going to be a lot of peeing. There's going to be a lot of drinking and a lot of peeing. It's like, we just need to self-care. We need to be near a toilet then, right? We need to call in sick to work. So I think really just practicing self-care too while we're trying to heal our symptoms, I think is really big too. Because when I talk to a lot of patients, there's a lot of stress. There's a lot of go, go, go. And it's like your body wants to slow down and rest. I feel like, I talk a lot about food, but I really think that it's important to talk about self-care. And that's where I love where Dr. Millspaw comes in and teaches about all of the mindful practices that we can do to like calm the body, calm the nervous system down.
Absolutely. 100%. I am a full believer in the team approach. And oftentimes, again, the less, the better, the less, medications and less sometimes we got to focus on the simple stuff, nutrition, wellness, kind of focus on our well-being. And it's so important when those seemingly small changes can make such a big difference. And again, medical school, great, awesome training, but we don't get much nutrition training at all.
Right.
And so again, I can make some small recommendations. So what's kind of your approach when you're dealing with nutrition in terms of, the workshops that you offer and the coaching that you offer?
Yeah, that's a great question. So my main approach with everyone is to reduce inflammation by reducing or removing inflammatory foods and bringing in all of the nourishing foods and just hyper focused on the nourishing foods. And so my philosophy isn't so much as to quit things cold turkey as it is to transition to non-inflammatory versions of the things that they love. Like, for example, dairy is a trigger. I feel like most everybody knows this. It's a trigger for symptoms. So we want to get dairy out. But it's like, if you love your milk and you love your cream cheese, it's like, well, we don't want to just get rid of that, because then what do you eat? So let's hey, let's transition to, a clean almond milk brand that only has almonds and water in it, right? Let's transition you to some cashew cream cheese, right? That's super delicious. And again, there's different products out there. Some have inflammatory ingredients. So it's really important to read labels. And so one thing I teach in what I consider like our foundational nutrition program is nourishing foods to help heal your pelvic pain. So it's an online program for 6 weeks. And we talk about the foods to remove and the ingredients to look out for to reduce inflammation and to calm symptoms down, right? So we want to avoid flares as much as possible. Bringing in all the nourishing foods, all the greens, the fruits, the vegetables, right? The basics, but really just like talking about what those are and what that looks like and how we do that. How to read labels. People do not read labels. Where, diet culture teaches us to read the fat content, the calories, the carbs. I'm not looking at any of that. I want you to look at the little paragraph at the bottom. What is in there? There's a whole bunch of poisons a lot of times in there that we just like overlook and ignore. And those, it's slowly poisoning us over time and making us toxic and making our symptoms worse. And how to meal prep and plan, right? It's like, how do we eat more of this stuff and how do we make it happen in our everyday life? So that's what I teach in that program. And then I have another program that I'm launching, and both are happening in July, Creating a Healthy Gut. And that is more just kind of a continuation. Let's focus even more on the gut. What supplements are helpful to bring in, like, and foods and herbs that can help heal your gut, and how do we restore balance and certain eating strategies that when your gut's really inflamed, like you can't just eat how you normally eat, or you can't eat how your friend eats. It's just like your gut is so upset. Let's, we're just eating bananas maybe for, a day, right? Like, or let's bring in some just potatoes, really like bland fruits and vegetables, like green juices, smoothies, things that are going to be calming, right? I know a lot of people, some people feel really good eating meat, and sometimes it can feel really good to give meat up for a while, just while we're healing. So it's like, when we look at our diet as just like, it's going to change throughout history all the time, and needs to, based on what we have going on, we're going to feel a lot better. So, and that's mainly what I teach people, whether I work individually or in the group programs, is how does food make you feel? And let's get you feeling good in your body.
Yes. I'm super excited about this, the gut course. Again, I've had patients sometimes come in prior to seeing me having been on antibiotics after antibiotics and after antibiotics, and that definitely affects the gut flora. Again, we have good bacteria in our body and we have bad bacteria in our body, and if the good bacteria, the balance of that good bacteria goes away, that can definitely affect absorption. It can affect, the inflammation and how we feel. So I think that nutritional aspect is going to play a huge role in helping with that.
Mm-hmm. Yeah. It's a real thing. And when we're out of balance, that's when all the symptoms occur. That's when we have more pain in our body. When especially and there's the mind gut, the brain gut connection that a lot of people talk about, and it's even just what we eat affects our mood. And a lot of people, I know everybody, we all love our coffee and caffeine. And it's like, sometimes when we're, people are feeling so badly, it's like coffee is the only thing that makes them feel good. And so it's like, I don't want to take that away out the gate, right? Because, it's important to understand in the long run, caffeine isn't helpful for healing. However, let's just get you on a coffee that's organic. Let's get you on a coffee that's mold free. So that's the transition. It's like, so again, it's not about, I think that's where it's not sustainable for people to change their diets. They're just like, I'm not getting rid of the only thing that makes me happy.
Right.
And I don't want you to.
Yes.
But let's like transition to something that's going to be a little bit more supportive than what you were already doing.
Absolutely. Awesome. Awesome. Yeah. I mean, there's a role in food, and sometimes there's those comfort foods that you knew and loved as a kid, and it just brings you back emotions and memories. And sometimes, again, that mind gut connection can be so powerful. But again, working with Dr. Millspa, with you, with us, again, we want to help retrain the body, retrain the pain, retrain the nerves, retrain the muscles, and retrain kind of how our body is processing things.
Yes. Oh, I love that. I know. I love our multidisciplinary approach. It's just, we can help you with everything.
Awesome. So what questions specifically about kind of nutrition do people have who are here today? Let's see.
Oh, yes. Do we have any questions? Fun.
I see one. Anyone familiar with Dr. Wise and Dr. Anderson's approach with paradoxical relaxation? I am familiar with that. And again, it's super important. Again, the kind of, again, that retraining the mind body aspect is super, super important. I know Dr. Millspa is kind of, that's her thing, and I'll defer to her, but I'm a big fan of kind of these relaxation techniques to help kind of get the body calm down from head to toe, right? Like, and I tell my patients, yes, we're talking about the pelvis here, but this is what affects you as, you know, as a human being. And so we want to make sure that we are addressing all the facets, whether it's nutrition, whether it's lifestyle, activity, job, work, family. It all plays a huge role in what we do. And kind of, again, that, like you talked about in the beginning, that self-care aspect, right? What do you need to kind of support yourself in order for you to be a good worker, a good parent, a good spouse, partner, and to, again, get you thriving the way you want to and get you doing the things that you want to do with a good quality of life.
Yeah. Oh, you froze. You're back. Yeah, exactly. I've always loved that analogy. You know, when you're on a plane, like, and the oxygen masks come out, whose mask you put on first? And everyone's like, I put on my kids, I put on my husband. It's like, no, put on yours first, because if you pass out, you can't help anybody.
Yes.
Right?
100%.
Yeah, I love
again,
that.
it's kind of like we're go, go, go. This is what we do. We're go, go, go. And sometimes if we don't catch ourselves, we're at a point where we're kind of crashing, but we want to sustain. We want to, you know, keep our checks and balances and make sure that we can sustain for the long run.
Yes, I love it. We do. We all have the same approach. So when patients come to you, so do you recommend when they're talking about diet, or do a lot of them know that like what they eat affects their pain? So what's the conversation around nutrition when patients come to you?
Yeah, it varies from person to person. So I have some patients that they've kind of been tracking what's been going on. They're like, I know that X, Y, and Z, like dairy, gluten, alcohol, if I have those, I'm going to have a bad day the next day. And so again, it's kind of like, okay, like and some of them are like, very fine with, if I avoid this, I'm going to be okay. The sometimes other patients may not necessarily have that awareness, and again, they may have been kind of thinking something else along the line. You know, sometimes it's like, oh, I had prostatitis or something else going on, and they weren't necessarily thinking about how what they were putting into them necessarily connected to how they felt. And so when we go through everything, we talk about things like, you know, GI symptoms, right? Are they having, and again, they might not be thinking about this coming in, but I'll probe them about that. Like, you know what, you know, how often are you going to the bathroom? How often, you know, are bowel movements uncomfortable? Are you having constipation or diarrhea, or are you feeling bloated? Like, and again, when we start thinking about those specific things, sometimes we may feel like, okay, yes, I do get bloated if certain, like if I eat this, or if I had a bad day or something like that. Or same thing with constipation, diarrhea. Like as we're asking these questions, sometimes it's starting to kind of put things together and say, hey, it may just be pain with sitting that I'm coming in for, but when I think about my bowels, my bladder behavior and things like that, it's kind of like, okay, there's a few more things that are also impacting their initial symptoms that they came in for.
Right. Yeah. And think about it, all the bowels right in there with all the pelvic stuff. Like it's
Absolutely.
all connected. And that's my approach is holistic. There's no such thing as an isolated symptom. If
Yes.
like you said, it's all of a sudden we've uncovered all these symptoms. It's the root cause is inflammation. And so we have to reduce toxicity to get rid of the inflammation and nourish those cells, nourish our bodies.
Absolutely. And again, when I think about the pelvis, I think about it kind of like a basketball, right? So you have your belly, you have kind of the hips, the back, and then there's the organs inside, and then you have your muscles kind of holding everything together. Your hips are coming out of here. And so again, there's this multifaceted approach, contribution coming from all of that. And then again, and kind of the common denominators are the nerves and the muscles that are kind of holding everything together. And if a certain nerve gets irritated here, you know what? They're going to talk to the neighbor right there. And so then we have this hyper excited place, these nerves are hyper firing. And then again, it travels up. It travels up to the nervous system, brain, spinal cord, all of that. And everything's kind of communicating each other in this hyper inflamed, hyper excited state. And again, what we want to do is work on calming things down from multiple different approaches, right?
Exactly.
Whether it's the medications, the injections, the physical therapy, nutrition, lifestyle changes, all of that, they all play a very important role in getting that calmed down.
I couldn't agree more. And so and I always tell people multiple things, it's a synergistic effect. Yes. Right? If I always tell people, you can eat all the kale you want. You can eat all the salad you want. You can drink all the green juice you want. But if you're super stressed out, right? Yeah. Your nervous system is constantly fight or flight. It's not going to benefit you. You're going to still, have a lot of symptoms. So it's really important to address all the areas. And I'm so glad that we have so many options for our patients to start to feel better.
Absolutely. Absolutely.
I want to make sure we answered all the questions that they put on our list.
Let's see any new questions.
Let's see.
Let's make sure. There's a question that I wanted to answer. So what are the next steps after a patient is referred to me? So oftentimes doctors I don't think I mentioned. So I work remotely, so I think oftentimes, I forget to say that, but so I work with people virtually. So we have a really fun video chat, kind of like this. And, it's like I'm the food therapist. So, I work remotely, but I'm in Brooklyn, so that's kind of fun. So I hail from Brooklyn at the moment, but I can work with anybody, anywhere, all over the world, in the United States. So, and that's awesome.
Yeah. Right?
Yeah, because you don't have to even be a pelvic pain patient. Because, I've recently had patients coming in from West Coast, things I know our office isn't there, but you have that benefit. You can work with patients from anywhere. And you don't necessarily have to be an established patient at Pelvic Rehabilitation Medicine. So Monique is available to everyone.
Yeah. And I do. I'm excited to help everybody with whatever symptoms they have. And actually, I'll just share, because we talked a little bit about the bowel stuff, but in my Creating a Healthy Gut, we're definitely going to talk about poop. We got to talk about it. There's a thing called the Bristol Chart, and that is a helpful reference frame, right? Or visual to say, what is going, yes. We want to be looking in the toilet, people. I'm going to go there. I'm going to do it. I'm going to make it fun. And I'll just share my own personal story that my number one symptom that I wasn't even aware of, I had gained a whole bunch of weight, from eating, not very good. And I just felt sick. I had back pain. I had, and I started researching, that's how I came into this profession, is that I just realized on my own health journey that I became passionate about healthy eating. It was so cool, but it's like I healed my own body, but I had chronic constipation and never even thought about it. You know, I was going to the bathroom once a week, and when I tell people that, they're like, oh, like, that's insane. It's like, well, I didn't know any better. I didn't know that that wasn't normal, but like that's toxicity is sitting in there. And so, you know, that's a kind of a, you know, if I get a flare, right? If I get stressed, if I'm traveling, if I eat something that I don't normally eat, I might experience constipation for a few days, right? And it's like, but I know I have the tools now. I know what to do. And so I'm going to share this tool. This is one thing I bring up a lot in the program, is magnesium is your #1 friend for constipation.
Absolutely.
Like, yes, take magnesium every day.
Yep, I take it myself.
Yes.
I love it. Like, it's been a game changer for me as well. And
right?
I didn't really think I had issues, but then I was like, oh, this is different in a good way. Like, I feel like I'm emptying fully.
Yes. Well, and of course it has a myriad of other things, right? It's calming. It helps us sleep. It's
great
good for
muscles.
the muscles.
Mm-hmm.
Yeah. But yes, it's very good for relaxing the bowels and helping you, you know, get it out.
Yes. And big caveat, the magnesium tablets or the capsules, not the liquid. I always tell patients, I'm not here to do a colonoscopy.
Yeah, the kind matters. And it is true. It's a little bit like vitamin C. If you take too high of a dose, sometimes you can have really soft stool, but you just go back to the dose underneath. My favorite, there's different kinds and everybody kind of has to try the one that works for them, but I find that my magnesium glycinate is the most absorbable. That's been my experience.
Okay. I haven't tried it. I've usually taken magnesium citrate, and I haven't had any issues with it.
Yeah, that's great. Yeah, I like the Calm magnesium. Are you familiar with that brand? It's like a powder. Do you know that one? Okay. Yeah. Anyway, again, it's like it's called Calm, but it's a nice. You just like it. Yes. Yeah, that one. It mixes in water. I trade off between, but yeah, again, and I also do a thermal magnesium. Like, can't get enough magnesium. You can spray it on your skin or use it as an oil.
This is the first time I'm hearing about that one.
Yeah, that really gets in, especially people that have like arthritis or joint stuff. That would be an excellent way to get some magnesium in, and probably would calm symptoms.
Absolutely.
Yeah. All kinds of fun tips when we get on here. We never know what we're going to talk about. It's really fun.
Yes. All right. What else? What else? Is there anything else? And again, I'm excited for all of the upcoming courses that you have lined up. I think it's going to be amazing.
Thank you.
And I've already gotten great feedback from patients that have joined your workshop. And so, yes, I'm excited for this to grow.
Yeah, we have a lot of fun. I do. I feel like that's my superpower. I make this kind of scary thing like really fun. I think it's fun. Yay, healthy eating.
Yes.
But I guess if we don't have any other questions, is there anything else that you wanted to talk about?
No, I think this was great. I learned a lot today, especially the topical magnesium. But yeah, love to chat again. And again, all of this, you know, what we put inside of us makes a huge difference, right? It's kind of like you are what you eat.
Yes. Yes, it's so true. Like, it always sounded cliche, but it's so true. And then we're also what we think, right? What we breathe, what we put on our skin.
Absolutely. So, we got to get back to the basics.
Yes, exactly. Well, yes, and that's what I help teach, is back to the basics, because we've just gotten far away from it. But that's just because of with all of the technology and all of the packaged food. It's just we definitely want convenience now, because that's the world we live in. But we also have to go back to the basics and cook. We have to cook for ourselves. Yes. I love it. Oh, thank you so much for chatting with me today. And
thank you, Monique. It was awesome.
Yeah, to anybody out there, please contact us if you have, especially if you have pelvic symptoms. Yes. You can find an office somewhat near you. I know that people will fly into offices, which is so awesome, because our team is so amazing. They are so passionate and they care so much about helping people with their pelvic symptoms. And and if you want to dive into nutrition, I am here anytime. anywhere.
Yes, love it. Yes, we are here for everyone. So again, I'm in Atlanta, huge airport here. So if you feel like you need our services, don't hesitate to even call and talk to our staff and say, hey, what is something unique that we can offer for you? Because again, pelvic pain can definitely be a long and frustrating journey, and we're here to help get that calmed down from multiple different tools and avenues that we have.
Yes, amazing.
All
All
right.
right, well, have a wonderful day
Thank
in
you.
Atlanta.
All right, you be well, and hopefully we can meet in person soon.
I would love that. I want to fly into Atlanta.
You are welcome anytime.
Thank you.
All right, be well. And
Take care.
one day I'll be back in New York.
Yay!
All right, take care.